Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on liver cancer. What is the liver cancer? Primary liver cancer is a malignant tumor that begins in the liver. There are different types. Hepatocellular carcinoma, HCC or hepatoma is the most common type of primary liver cancer, and it starts in the main cell types in the liver, the Kupffer cells, the hepatocytes. Then is the cholangiocarcinoma or bile duct cancer, starts in the cells lining the bile duct which connect the liver to the bowel and gall bladder. Then there comes the angiosarcoma, which starts in the blood vessels. This is a rare type of liver cancer that is more likely to occur in people over 70 years of age. Then there is secondary cancer in the liver, which is started in another part of the body but has spread to the liver. If you have secondary cancer in the liver, it may be useful to read information about the primary cancer in conjunction with this information, or about the cancer of unknown primary. A secondary cancer is named after the primary site where it began. For example, bowel cancer with liver secondaries. In this information, we use the term secondary cancer in the liver to refer to any cancer type that has spread to the liver. It is estimated that more than 2,900 people were diagnosed with liver cancer in 2022. The average age at diagnosis is 68 years old. Liver cancer symptoms are more likely to appear as the cancer grows or becomes advanced. Symptoms may include weakness and tiredness, pain in the abdomen, swelling of the abdomen due to the buildup of fluid, ascites, pain in the right shoulder, appetite loss and feeling sick, weight loss, yellowing of the skin and eyes, which is called jaundice, pale bowel motions, and fever, malaise. Causes of liver cancers might be hepatitis B or C. Viruses which result in long-term chronic infection can cause liver cancer. This is the biggest known risk factor for primary liver cancer in Australia. There are other factors that can increase the risk of developing liver cancer, such as fatty liver disease or genetic disorders, including hemochromatosis or alpha-1 antitrypsin deficiency, type 2 diabetes, hepatitis B or C, alcohol consumption, obesity, tobacco smoking, exposure to certain chemicals, aflatoxins. And the diagnosis of liver cancer, tests to diagnose both liver cancer and secondary cancer of the liver include blood tests. Blood tests can check how well the liver is working and how well blood clots, as well as checking certain chemicals known as tumor markers, whether you have hepatitis B or C, and any genetic problems such as antibodies of hepatitis B or Australian antigen, and antibodies for hepatitis C as well, and core antibodies, envelope antibodies. Ultrasound also the most commonly used method to look for primary liver cancer, and ultrasound produces pictures of the organ and can show the size and location of abnormal tissue in your liver. CT scan produces three-dimensional pictures of several organs at the same time and can help doctors plan the surgery. It can also see if the cancer has spread to the parts of the body. An MRI scan produces detailed cross-sectional pictures of the body and can show the extent of a tumor and whether it is affecting the main blood vessels around the liver. Then comes the role of PET CT scan, PET CT scan, more commonly used for secondary cancers in the liver. PET scans produce three-dimensional color images that show where any cancers are in the body. Then is the role of biopsy. Biopsy is taken when a small amount of tissue is removed for examination under a microscope. The biopsy is done by either fine needle aspiration (FNA), which involves a local anesthetic, and a thin needle, which removes the cells, or laparoscopy, keyhole surgery, which is done under general anesthetics and allows the doctor to look at the liver and surrounding organ as well as take tissue samples using a laparoscope. Other tests, if you have secondary cancer in the liver, you may have further tests to find out where the primary cancer started, if this is not already known. After a diagnosis of liver cancer, after finding out you have a liver cancer, you may feel shocked, upset, anxious, or confused. These are normal responses. For most, it will be a difficult time. However, some people manage to continue with their normal daily activities. Talk about your treatment options with your doctor, family, and friends. Seek as much information as you need. It is up to you how involved you want to be in decisions about your treatment. Learn about best liver cancer care. Treatment for liver cancer. The most common treatments for primary liver cancer are tumour, ablation, and chemotherapy delivered directly into the cancer. The most common treatments for secondary cancer in the liver are chemotherapy, or a combination of surgery and chemotherapy. Surgery can involve removing part of the liver or a liver transplant, where the whole liver is replaced by a donor liver. Surgery is suitable for a small number of people with liver cancer, and it will depend on the size, number, and position of the tumors. Surgery to remove part of the liver is called a partial hepatectomy. Following surgery, the remaining part of the liver can usually repair itself if it is not damaged and grow back to normal size over a few months. If there are tumors in both sides of the liver, surgery may be conducted over 2 stages to allow the liver to regrow following the first operation. For some people, it is not possible to remove part of the liver and they may be considered for a transplant. A number of factors are considered before someone is eligible for a liver transplant, including the person's overall health. In addition, a person should not smoke or take illegal drugs and should have stopped drinking alcohol for at least 6 months. A liver transplantation may be possible. However, waiting for a suitable donor liver may take a long time. During this time, most people have other treatment to control the cancer. Then the tumor ablation is used most commonly for small primary liver cancer. It is rarely used for secondary cancer in the liver. The most common types of tumor ablation treatment use radio waves and microwaves to heat and destroy cancer cells. This treatment is administered by either a needle inserted through the skin, percutaneous ablation, or a surgical cut ablation with surgery. Less common types of ablation treatment include alcohol injection, where pure alcohol is inserted into the tumor to destroy cancer cells, and cryotherapy, which is surgery that freezes and kills cancer cells. Then is the chemotherapy. Depending on the type of liver cancer you may receive chemotherapy drugs to kill, shrink, or slow the growth of the tumor. Chemotherapy can be given systematically via tablets or intravenously through a drip, which means it goes throughout the whole body. This may give following other treatments such as surgery or cryotherapy to get rid of any remaining cancer cells. It is not usually used to treat primary liver cancer unless the cancer has spread to other parts of the body. Systemic chemotherapy can also be used as a palliative treatment to slow down cancer growth and reduce pain. Chemotherapy can also be given directly into the tumor, which is called as chemoembolization or TACE. As it is targeting the tumor directly, stronger drugs can be used. TACE is more commonly used for primary liver cancer. And then biological therapy, a range of treatments that work against the cancer cells by either stopping their growth or function or by helping the body's immune system destroy them. Used for both primary and secondary cancers in the liver. It can be used in conjunction with or after other treatments for cancer. Then is selective internal radiation therapy, SIRT, also known as radioembolization. This treatment targets liver tumor directly with high doses of internal radiation in tiny beads. It is used for both primary and secondary cancers in the liver when the tumors cannot be removed with surgery. It is not available in all areas, so talk to your doctor about availability and costs involved in it. And then is endoscopic stent placement. If the cancer in the liver has obstructed the bile duct and the bile has then built up in the liver, it may be recommended that a stent thin tube is placed in the liver to drain the bile and ease the symptoms. Then is palliative care. In some cases of liver cancer, your medical team may talk to you about the palliative care, and palliative care aims to improve your quality of life by alleviating symptoms of cancer as well as slowing the spread of liver cancer. Palliative treatment can relieve pain and help manage other symptoms. Treatment may include radiation therapy, chemotherapy, or drug therapies. Treatment teams, depending on your treatment team may consist of a member of different health professionals such as GP, general practitioner, hepatobiliary surgeons, gastroenterologists, hepatologists, medical oncologists, radiologists. Nuclear medicine specialist coordinates the delivery of radioactive scans and treatments, and cancer nurses assist with treatment and provide information and support throughout your treatment, and other allied health professionals, social workers, pharmacists, and counselors. And then is the screening for liver cancer. There is currently no national screening program for liver cancer available in Australia. Preventing liver cancer. Hepatitis B and C infections are the biggest known risk factors for primary liver cancer in Australia. There are prevention strategies to reduce the spread of hepatitis B and the incidence of primary liver cancer, including vaccinating all at-risk people against the virus and monitoring the health of people already infected with the virus. So by providing and administering the vaccine of hepatitis B by the name of hepatitis B vaccine. Prognosis of liver cancer. Prognosis means the expected outcome of a disease. An individual's prognosis depends on the type and stage of the cancer, as well as their age and general health at the time of diagnosis. However, your doctor may give you a prognosis, the likely outcome of the disease based on the type of liver cancer you have, the test results, the rate of the tumor growth, as well as your age, fitness, and medical history. The prognosis for liver cancer is better when diagnosed in the early stages. What are the causes of liver cancer? Being overweight or having obesity, having a long-term hepatitis B virus or hepatitis C virus infection, smoking cigarette, drinking alcohol, having cirrhosis, which is a scarring of the liver, which can also be caused by hepatitis and alcohol use, are all risk factors for causing liver cancer. The exact cause of liver cancer is unknown, but most cases are associated with damage and scarring of the liver known as cirrhosis. Cirrhosis can have a number of different causes, including drinking excessive amounts of alcohol over many years and having long-term hepatitis B, hepatitis C viral infection. What are the early signs of the liver cancer? When signs and symptoms do appear, they may include unintentional weight loss, loss of appetite, upper abdominal pain, nausea and vomiting, general weakness and fatigue, abdominal swelling, jaundice where your eyes and skin turn yellow and white, chalky stools. Primary liver cancers are tumors that develop directly from liver tissue. Secondary metastatic liver cancers are tumors that start in another part of the body, such as colon, then spread to the liver. Worldwide, the most common risk factor for liver cancer is chronic long-term infection with hepatitis B virus (HBV) or hepatitis C virus (HCV). These infections lead to cirrhosis of the liver and are responsible for making liver cancer the most common cancer in many parts of the world. Heavy alcohol users who have cirrhosis are 10 times more likely to develop liver cancer compared with heavy alcohol users who do not have cirrhosis. Studies have shown that there is also an increased risk for liver cancer in people with hepatitis B virus or hepatitis C virus infection who use alcohol heavily. The general 5-year survival rate for liver cancer in the United States is 20% compared to 3% 40 years ago. Survival rate depends on several factors, including the stage of the disease. For the 43% of people who are diagnosed with liver cancer at an early stage, the 5-year survival rate is 35%. In some people, the liver cancer itself can cause pain, particularly in the upper right area of the abdomen, belly, and sometimes in the right shoulder. In advanced cancer, the liver may press on the nerves that connect to the shoulder, the phrenic nerve, which is called as the referred pain. Stage 1 liver cancer is divided into stage 1A and stage 1B. Stage 1A means there is a single tumor in the liver that is 2 cm or less and it has not grown into the blood vessels. Stage 1B means there is a single tumor that is more than 2 cm and it has not grown into the blood vessels. In the United States, the average age at onset of the liver cancer is 63 years. Genders: men are more likely to develop liver cancer than women by a ratio of 2 to 1. Signs and symptoms of liver cancer often do not show up until the later stages of the disease, but sometimes they may show up sooner. If you go to the doctor when you first notice symptoms, your cancer might be diagnosed earlier, when treatment is most likely to be helpful for you. Almost 40 or out of 100 people, almost 40% will survive their cancer for 1 year or more after diagnosis. Almost 15 in 100 people, almost 15% will survive their cancer for 5 years or more after they are diagnosed. Many liver cancer could be prevented by reducing exposure to known risk factors for the disease. Avoid and treat hepatitis B and C infections. Limit alcohol and tobacco use. Get to and stay at a healthy weight. Limit exposure to cancer-causing chemicals, aflatoxins. Treat diseases that increase liver cancer risk. Being overweight or obese increase the risk of liver cancer. Diabetes and non-alcoholic fatty liver disease are more common in people who are overweight, so this may partly explain the link. More than 20 out of 100 cases of liver cancer, 20% in the UK, are caused by being overweight or obese. You cannot live without working liver. If your liver stops working properly, you may need a transplant. A liver transplant may be recommended if you have end-stage liver disease, which is chronic liver failure. This is serious, life-threatening liver disease. More than 8 lakh people are diagnosed with this cancer each year throughout the world. Liver cancer is also leading cause of cancer death worldwide, accounting for more than 7 lakh deaths each year. Liver cancer is often treatable, but it can be difficult to treat. The treatment you will depend on if the cancer starts in the liver primary or spread from somewhere else secondary. But treatments for primary or secondary liver cancer are similar, the size and type of the liver cancer you have. In general, only early stage liver cancer can be cured. Doctors use diagnostic tests to find out the cancer stage. So staging may not be complete until all of the tests are finished. Knowing the stage helps doctors recommend the best kind of treatment and may help predict a patient's prognosis. Despite the fact that the liver cancer lacks a strong hereditary component, a family history of disease, risk factors can increase an individual's risk of developing liver cancer. Hepatitis B virus and C virus infections and heavy alcohol usages all are strong risk factors for liver cancer. Unfortunately, when liver cancer is advanced, treatment will not be able to cure it. It aims to control the cancer, relieve symptoms, and give you a good quality of life, which is palliative care. A CT scan of the abdomen can help find many types of liver tumors. It can give specific information about the size, shape, and location of any tumors in the liver or elsewhere in the abdomen, as well as nearby blood vessels. While stage 4 liver cancer has low survival rate, some patients may live for years after their diagnosis. There are treatments available to help boost quality of life and prolong survival. New therapies are always being developed. It is often hard to find liver cancer early because signs and symptoms often do not appear until it is in its later stages. Small liver tumors are hard to detect on a physical exam because most of the liver is covered by the right rib cage. By the time a tumor can be fed, it might already be quite large. Liver cancer is life-threatening illness and one of the fastest growing cancer types in the United States. There are two kinds of liver cancer, primary and secondary. And primary cancer starts in your liver, and secondary cancer spread to your liver from other parts of your body. Cases of non-alcoholic fatty liver disease have more than doubled in the past 2 decades, now affecting around 1/4 of the country's population. The condition leads to inflammation and scarring in the liver, similar to that caused by alcohol abuse, and increases the risk of liver cancer. What food should I avoid if I have liver cancer? Saturated or trans fats such as red meats, full fat milk and pastries, added sugars such as sweetened beverages, cakes, cookies and candies, salts such as sodium-rich canned soups, cured meats and potato chips. Alcohol should be avoided. The liver is essential for digesting food and ridding your body of toxic substances. Liver disease can be inherited, genetic, and liver problems can also be caused by a variety of factors that damage the liver, such as viruses, alcohol use, and obesity. Here are 13 tried and true ways to achieve liver wellness. Maintain a healthy weight, eat a balanced diet, exercise regularly, avoid toxins, use alcohol responsibly, and avoid the use of illicit drugs. Avoid contaminated needles, syringes. Get medical care if you are exposed to the blood. A liver blood test measures the level of various things in your blood like proteins, liver enzymes, and bilirubin, and this can help check the health of your liver and for signs of inflammation or damage. Your liver can be affected by liver infections like hepatitis B and hepatitis C. Pain at the top right side of your tummy or in your right shoulder, symptoms of indigestion such as feeling full very quickly when eating or achieving satiety, a very swollen tummy that is not related to when you eat. No single blood test can diagnose liver cancer, but liver cancer blood test can detect signs of liver dysfunction. Depending on a person's signs and symptoms, the doctor may recommend further testing such as liver biopsy. Although blood tests cannot diagnose liver cancer, they can screen for signs of cancer. Liver transplantation has proven to be the most effective treatment for patients with hepatocellular carcinoma, a common type of liver cancer. If a patient has liver disease such as cirrhosis, liver transplantation can also further the risk of recurrence following treatment. Liver cancer can spread quickly depending on the type of cancer. Angiosarcoma and angiosarcoma types of liver cancer are fast spreading, and whereas hepatocellular carcinoma spreads late in the disease. Lean meats such as chicken, fish or turkey, eggs, low-fat dairy products such as milk, yogurt and cheese or dairy substitute nuts and nut butters. Good source of whole grain foods include oatmeal and whole bread and white breads and brown rice, whole grain pastas. Stage 0. What is stage 0? An early stage. This is one tumor that is 2 cm or smaller. It is not causing any symptoms and the tumor has not grown into the large blood vessels in the liver. Treatment options might include ablation, embolization, or both for the liver tumors. Other options may include targeted therapy, immunotherapy, chemotherapy, either systemic or by hepatic artery infusion, and or radiation therapy. Some of the tests and procedures used to diagnose liver cancer, such as CT scan and MRI, may be used in the staging process. The positron emission tomography PET scan may also be used. PET scan procedure is used to find malignant tumor cells in the body. A complete blood count measures 3 types of blood cells circulating in your bloodstream: the white blood cell, red blood cell, and the platelet. The results can help healthcare provider diagnose cancer or detect whether cancer has spread. Liver cancer, also called hepatic cancer, happens when abnormal cells grow inside the liver, one of the largest organs in your body. If you have the cancer in the bile duct, a series of thin tubes that go from the liver to the small intestine, you will also be treated by liver cancer doctors or hepatologists. Changes that can occur with an end-stage liver disease include jaundice and the increased risk of bleeding, build-up of fluid in the abdomen, ascites. Another symptoms of end-stage liver disease include muscle cramps, trouble sleeping at night, fatigue, decreased appetite and intake of food, and depression. Yellowing of the skin or whites of the eye, jaundice, swelling of the legs, ankles and feet caused by the build-up of fluid, edema, swelling in your abdomen caused by the build-up of fluid known as ascites are the signs of damaged liver. The liver has a unique capacity among other organs to regenerate itself after damage. The liver can regrow in normal size even after up to 90% of it has been removed. But the liver is not invincible. Many diseases and exposures can harm it beyond the point of repair. Unfortunately, when your liver is advanced, treatment would not be able to cure it. It aims to control the cancer, relieve symptoms, and give you a good quality of life. It is called the palliative care. The journal 5-year survival rate for liver cancer in the United States is 20% compared to 3% 40 years ago. Survival rate depends on several factors including the stage of the disease. For the 43% of people who are diagnosed with liver cancer at an early stage, the 5-year survival rate is 35%. If your cancer is at stage A, when diagnosed, a complete cure may be possible. The three main ways this can be achieved are removing the affected section of liver, known as resection, having a liver transplant, an operation to remove the liver and replace it with a healthy one. But liver cancer remains a life-threatening disease. Data show that 35% of people treated for early-stage hepatocellular carcinoma (HCCC) liver are alive 5 years after diagnosis. About 12% of people treated for HCC that has spread to nearby tissues, organs, or lymph nodes are alive 5 years after diagnosis. Liver cancer can spread quickly depending on the type of cancer. Hemangiosarcoma and angiosarcoma types of liver cancer are fast spreading, whereas the hepatocellular carcinoma spreads late in the disease. Now I'm ending my discussion on this topic with the quotes of Chinese philosopher Lao Tzu, and one of his quote is, "Nature does not hurry, yet everything is accomplished." Another one is, "Knowledge is the treasure and practice is the key to it." And third one is, "Life is a series of natural and spontaneous changes. Don't resist them, that only creates sorrow. Let reality be reality. Let things flow naturally forward in whatever way they like." And in the last, "Victory over others gives strength. Victory over oneself gives fearlessness." Thank you for watching this video, and kindly share this video with other individuals as well. And if you have liked this video, then don't forget to subscribe my channel. I hope so that you would have liked the quotes of this Chinese philosopher. This video, have a wonderful nice day. Thank you very much.